Have you ever wondered what a doctor really thinks when they glance at your chart and see age 65, 72, maybe even 84? I used to believe that doctors were careful, respectful, and always had our best interests at heart, but something started to shift after I turned 60. Suddenly, the questions got shorter. I was interrupted more often, and one time the doctor didn't look at me once during the entire visit. At first, I thought maybe I was imagining it. Until one afternoon, sitting in a waiting room, I overheard two young doctors chatting behind a slightly open door. Older patients are easy, give him something safe, no need to explain too much. They probably won't remember it all anyway. I sat there stunned, not angry, just quietly heartbroken, because I realized somewhere along the way growing older had become a reason to be dismissed. That moment lit a fire in me. I started writing down every strange, rushed, or dismissive experience during my medical visits. I talked to friends. I interviewed people who worked inside the system. Nurses, doctors, even former insurance reps. What I found chilled me. Doctors aren't bad people, but the system they work in has taught them quietly, subtly, to treat older adults with a warped lens. Treatment plans based more on age than on real needs, assumptions that we're forgetful, anxious, or hard to teach. And worst of all, silence, not being told all the options because they assume we don't need or won't understand them. Today, I'm going to share with you 5 raw truths about how the medical system often underestimates older patients, truths that affect your care, your safety, and possibly your life. But I'm not here to scare you. I'm here to help you take your power back. Because you deserve answers, you deserve choices, and you deserve respect. If you've ever walked into a doctor's office and walked out feeling small, I believe this video will change that. If you've ever experienced something similar, hit that like button and share your story in the comments. We need to hear each other. And if this is your first time here, I'm truly glad you found this channel. Subscribe and turn on notifications. This video might help you or someone you love. Avoid a critical medical mistake. Now, let's start with a truth nobody likes to admit, but that everyone needs to hear. When your age becomes a silent burden, they label you costly and complicated before you even speak. I want to tell you something most doctors won't say out loud, but it happens every single day. The moment you walk into that exam room, before you even open your mouth, your age is already shaping how they see you. You haven't described your pain, your symptoms, or your story, but in their mind, a quiet equation starts running. How old is this patient? Will they react poorly to treatment? Is it worth doing the full workup? Can they recover as well as a younger person? And sometimes, even if you're sharp, independent, and well-prepared, you still get lumped into the elderly equals complex equals resource draining category. At first, I thought this only happened with a few overworked or inexperienced doctors. But after 3 years volunteering in senior health groups across California, I realized this bias is deeply embedded in how the American healthcare system works. I remember Mrs. Gladys, 82 years old, retired school teacher, sharp as a tack. She went to her primary care doctor with unexplained weight loss and persistent insomnia, classic red flags for early cancer or depression. The doctor asked a few quick questions and said, "At your age, it's normal to have some sleep issues. Just try light exercise and keep your mind busy. No blood work, no referral." 6 months later, she was diagnosed with stage 3 colon cancer. Now let me ask, could that have been caught sooner if the doctor hadn't silently decided she was just getting old? This isn't about bad doctors, it's about a broken system. Doctors are not cruel, they are exhausted. They get about 15 minutes per patient. They're swamped with paperwork. Their pay depends on quantity, not quality of care. In that system, anything that takes extra time, like older patients with multiple symptoms, becomes something they quietly brace for. A doctor I spoke with in Minnesota put it plainly. "I hate to admit this, but when I see an 80-year-old on the schedule with a long symptom list, I already know I won't have time to do it right. So I pick the simplest issue and try to move on." That's the reality of industrialized medicine. People become cases, and older adults, unfortunately, become bad economics. The assumptions go deeper, especially about your memory and comprehension. A Johns Hopkins study found that doctors give significantly less detailed explanations to patients over 70 because they assume we won't understand or remember anyway. I saw it happen. A 40-year-old was given a 5-minute breakdown of his heart medication, side effects, diet restrictions, the works. Right after, a 78-year-old woman was told, "It's a good medication. Just let us know if anything weird happens." That chilled me, because medical knowledge, if not explained clearly, can lead to confusion and serious harm. So what can we do to shift that lens without confrontation, but with quiet authority? Here's what I've learned after years of trial and error. Always bring a clear written summary to your visit, 1 page max. Example: fatigue has increased 50% in the last 2 months, despite sleeping 7 hours/night. Already ruled out dehydration and anemia, like thyroid and heart tests. That signals you're not here to ramble, you're here for real answers. Speak like a partner, not like someone asking for help. I've said, "I know your time is tight today. I just need 2 minutes to present what I've been tracking for 2 months." It changes the tone instantly. Bring a support person when possible, even just a friend. Doctors communicate more carefully when they know someone is observing. It's subtle but real. Take notes visibly, respectfully, and say why. "I'll jot this down so I don't forget anything important." This establishes a boundary. You are engaged and expect to be treated accordingly. I'm not sharing all this to scare you, I'm sharing it to wake us up. Your age should never be treated like a liability. But in today's system, it often is, unless we're prepared. This video isn't just for you to watch. It's for you to act on, starting at your next appointment. When old age becomes a medical excuse. How doctors dismiss real symptoms by calling them normal. One of the most dismissive moments I've experienced in a medical visit is when a doctor nods and says, "At your age, that's normal." You know what? That one sentence is the reason millions of older Americans are misdiagnosed every single year. Not because we're fragile, but because our real symptoms are being minimized, disguised as just aging. I used to think doctors were just trying to comfort us. But after years of conversations with geriatric specialists, I've come to understand. This is a form of gaslighting, but with a stethoscope. Old age, the socially accepted medical excuse. Dr. Michael Torres, a geriatrician who spent over 30 years fighting ageism in healthcare, once told me, "The phrase 'because you're old' is being used to avoid proper medical investigation. That's not evidence-based medicine. That's age-based bias dressed up in clinical language. And the consequences are all too real." According to the American Geriatric Society, 85% of serious conditions in older adults are initially misattributed to aging before a correct diagnosis is made. Heart disease gets labeled as normal fatigue. Thyroid disorders become age-related energy loss. Depression gets brushed off as adjusting to getting older. Even early cancer symptoms are dismissed as normal aging. Carl's story hits home for me. Carl, 67, is a close friend of mine from Arizona, former construction supervisor, sharp mind, tough spirit. For 8 months, he told his doctor about joint stiffness, morning fatigue, and widespread aches. Every time he heard the same thing. "Carl, you're not a young man anymore. Your body's just slowing down." Carl started doubting himself, but his wife, a retired nurse, pushed him to request a full panel of blood work. The results: severe rheumatoid arthritis with joint damage already spreading to his wrists, damage that might have been prevented with earlier diagnosis. Carl didn't blame the doctor, but he told me he felt betrayed for trusting someone else more than his own body. How symptom minimization shows up in real life. They normalize your complaints with soft language. Everybody your age deals with that. It's just hormones. Just rest more, it'll pass. They offer vague lifestyle fixes instead of investigation. Try yoga, sleep better, reduce stress. But no testing, no digging deeper. They gender your symptoms. Women, it's just menopause. Men, that's just what getting old feels like. They dismiss mental health signs as life transition. Anxiety, depression, memory lapses, all chalked up to natural aging rather than medical concerns. The worst part, you start to doubt yourself. I once sat next to an older woman at a clinic who told her doctor, "I haven't felt like myself in weeks. I'm forgetting odd things." The doctor smiled gently and said, "That's normal for someone your age, don't worry too much." She nodded politely, but outside the clinic she turned to me and asked, "Do you think I'm starting to go senile?" That kind of self-doubt leads people to delay treatment, ignore symptoms, and slowly lose trust in the medical system. So how do we push back clearly, respectfully, and effectively? Ask direct, challenging questions when symptoms are brushed off. If your doctor says that's normal for your age, ask, what percentage of people my age experience this exact symptom? Or, is there any research confirming this is normal, or are we assuming? Most doctors won't have a clear answer because they are relying on bias, not data. Anchor symptoms in time. Don't say, I felt more tired lately. Say, I felt fine until March 15. Since then, I've needed to nap daily, something I've never done before. That turns an aging complaint into a clinical red flag. Ask the age reversal question. If I were 40 years old with this symptom, what tests would you run? It forces the doctor to examine whether age is affecting their clinical judgment. Use concern escalation calmly but firmly. I understand age plays a role in energy levels, but this is a sudden, significant shift from my baseline. I'm worried there could be an underlying issue. What can we do to rule that out before assuming it's just aging? Bring someone with you not because you're weak, but because you have support. Doctors explain more carefully when there's a witness. That person can ask follow-ups or help take notes. Here's what I believe with my whole heart. When you ask the right question, you get a different kind of care. Not just for yourself, but for every older adult who comes after you. They quietly assume you're mentally slipping and can't handle complex treatment plans. One of the most damaging assumptions in senior healthcare is this quiet belief that after 65, your brain just can't keep up. Doctors often assume that older patients are slower to understand, less able to remember, and not likely to follow through on a detailed medical plan. So they explain things only briefly, avoid advanced treatment options, and make decisions for you based on age, not your actual ability. It's a dangerous loop. Dr. Amanda Richardson, a neurologist who studies age bias in medicine, said something that stopped me cold. Medical professionals routinely underestimate the thinking ability of patients over 65. They assume we can't follow complex care, so they don't bother explaining it. See the trap. When a doctor believes you won't understand, they stop giving you the chance to. And the result? You're left with limited options, weaker treatments, not because of your health, but because of someone else's assumption. Let me tell you about Louise. She's 71, a retired chemistry professor, sharp mind, clear memory. When diagnosed with early-stage breast cancer, her oncologist immediately suggested a full mastectomy. No mention of breast-conserving surgery, reconstruction, targeted therapy, or clinical trials. When Louise asked why these weren't discussed, the doctor replied, "At your age, I think simpler is better." It took her nearly 3 months, second opinions, and her own research to finally get access to the same treatment options younger women receive for the exact same diagnosis. This kind of cognitive bias shows up in subtle but powerful ways. The doctor speaks more slowly and uses overly simplified language. They avoid technical terms even when your background says you can handle them. They skip over key medical details, assuming you can't follow them. They don't even ask if you have questions because they don't expect you to ask. And it doesn't stop at conversation. Medication choices suffer too. Many doctors prescribe easier-to-take drugs, not the most effective ones, assuming you can't stick to multiple doses per day. They'll choose a once-daily pill over a more effective 3 times a day option, even though they wouldn't do that for a 40-year-old. Tech bias is another big piece of the problem. Doctors often assume that older adults don't use health apps, don't check online medical portals, can't track their own records electronically. But they are wrong. Many of us use smartphones, smart watches, digital blood pressure monitors, and we're more organized than some 30-year-olds. When doctors assume we're not tech-savvy, they leave us out of the very tools that could help us most. And here's the most dangerous part. When you're treated like someone who can't understand long enough, you start to believe it. You stop asking questions. You lose confidence. You begin to rely on others, when in fact you were fully capable all along. So how do we break that stereotype, gently but firmly? Start every visit by sharing your background. I spent 30 years managing complex projects. Please walk me through all the medical details so I can make an informed decision. Ask for high-level explanations. Can you explain the mechanism of the condition and how each treatment works in the body? You're showing not just willingness to understand, but capability. Bring materials that show your initiative. A research article you read, notes you've written, questions you've prepared. This forces the doctor to treat you as an active participant. If you're offered a simple solution, ask this. If I were 45 and had this condition, what would your recommendation be? I want to know all available options, even the complex ones, so I can choose wisely. Use technology right there in the room. Open your health tracker, log into your patient portal, look up medication data on your phone. Let them see you're not afraid of tools that support your care. Ask for a printed or digital treatment plan. Please give me the full treatment options in writing so I can review them carefully at home. That sends a clear message. You're not just there to be told what to do, you're there to decide. You're not forgetful, you've been underestimated. And the moment you reclaim your right to understand, you reclaim your right to better care. They don't prescribe to heal you, they prescribe to control you. I used to believe medication was always about healing. But at this stage in life, I've come to understand a hard truth. Many medications prescribed to older adults aren't for healing, they're for control. Especially when it comes to behavioral control. Sedatives, antipsychotics, mood stabilizers, they're often used not because there's a clear diagnosis, but because they make a patient easier to manage. More passive, less demanding, quieter. Dr. James Martinez, former medical director at a long-term care facility, said something that chilled me. I've seen countless prescriptions written not to improve health but to reduce staff workload. Anxious older patients get sedatives. Agitated ones get mood stabilizers. The ones who ask too many questions, antidepressants. It's chemical handcuffs disguised as care. That phrase, chemical handcuffs, stuck with me. And the statistics are shocking. Over 40% of older adults are prescribed at least one psychiatric medication. But only 12% have an actual mental health diagnosis requiring such drugs. So why are the rest being medicated? Convenience, easier management, less staff time. Less trouble, but the burden of side effects. That's all on the patient. This isn't theory, I've seen it happen. Take Beverly, 69, a retired high school principal. After a hip replacement, her recovery was slower than expected. She began asking lots of questions about her rehab timeline. Staff found her difficult. So the doctor prescribed her an anti-anxiety medication to help her relax. But instead of relaxing, it made her groggy and unsteady. She fell in the bathroom and broke her arm. Her surgical recovery was on track, but that medication setback added 4 more months to her healing time. This kind of drug misuse isn't limited to psychiatric meds. Sleep aids are given for natural age-related changes in sleep, not actual sleep disorders. Blood pressure meds are dosed too high, causing dizziness and fatigue, then misinterpreted as physical decline. Pain meds are underprescribed out of fear we'll complain too much or get dependent. And when side effects show up, doctors often shrug. That's the trade-off. Worse still, many medications cause the very symptoms they claim to treat. Sedatives cause confusion, right arrow, and you get labeled with dementia. Mood stabilizers create emotional numbness, right arrow, and you're diagnosed with depression. Sleep pills disrupt your natural cycle, right arrow, leading to actual insomnia, which leads to more meds. Long-term care facilities often support this approach. Sedated patients require fewer staff. Insurance companies prefer it too. Pills are cheaper than therapy or thorough assessments. Even family members sometimes ask for meds, not because they are needed, but because they don't know how to handle emotional distress in their loved ones. So how do you protect yourself or someone you love from chemical control? Always ask what each medication is for. What condition does this treat? Is there a clinical marker to track its effectiveness? When will we know whether to stop it? Be wary of prescriptions for vague emotions. If a doctor says, "You seem anxious, this will help you relax," without a diagnosis, proceed with caution. Research every drug. Use trusted medical websites to look up side effects, drug interactions, non-medication alternatives. Ask for a clear treatment goal. What improvement should we expect and in what time frame? If that doesn't happen, will you consider tapering or switching? Have a pharmacist or geriatric specialist review your medication list. They often catch drugs you don't need, dangerous combinations, and overmedication patterns. Document your mental and physical baseline before starting any psychiatric drug. Memory, balance, mood. That way, you'll know if a drug is changing you and have the proof to stop it if needed. Have a trusted advocate ready to speak on your behalf. If your thinking or speech becomes affected by medication, you'll need someone alert and informed to step in and question what's happening. You may not be able to change the whole system, but you can change how you engage with it. Start by asking. Start by understanding. And most importantly, start by defending your right to be treated as a person, not just a patient. They quietly calculate your remaining life value and use it to decide your care. I used to believe that medical decisions were based purely on your current health. But then I learned something that gave me chills. Some doctors are quietly calculating how much your life is still worth before deciding how much care you deserve. And they don't do this emotionally. They use hard economic math. Dr. Patricia Chen, a professor of medical ethics, once explained it bluntly. In med school, we're taught about something called QALY, quality adjusted life years. It assigns a numerical value to a person's life. A 70-year-old gets calculated as having fewer useful years left than a 40-year-old, and that affects decisions about everything from organ transplants to cancer treatment. This is ageism disguised as healthcare economics. This kind of thinking leads to real consequences. Older patients are denied life-saving surgeries, even when they're healthy enough. They're excluded from advanced therapies or modern treatments, not because they're medically unfit, but because the system decides it's not worth the investment. Let me tell you about Walter, age 68, a retired engineer. He was diagnosed with kidney failure, but instead of being offered dialysis like a younger patient would, he was steered toward palliative care. The reason: dialysis might not be worthwhile at your age. Walter refused to accept that. He pushed for treatment, and after receiving dialysis, he recovered well. He went on to live 7 more full, healthy years. 7 years that he almost lost because someone silently decided he wasn't worth it. This kind of bias doesn't just affect treatment, it affects diagnosis too. MRI and CT scans are often withheld. Preventive screenings are skipped. Deeper testing is deemed unnecessary based solely on age. Mental health care is even worse. When younger adults show signs of anxiety or depression, they get therapy, medications, emotional support. But when older adults show the same signs, they're told that's normal at your age. No treatment, no counseling, no support. The worst part is when older patients start to believe they don't deserve care. After years of being told no, some begin saying, "I guess there's no point in trying anymore." That's not peaceful acceptance. That's silent surrender caused by being denied a chance to hope. Want to see age bias at its clearest? Visit an emergency room. Older patients with the same symptoms as younger ones get less testing, shorter exams, faster discharges. Doctors don't always mean harm, but many admit a patient's age affects how deeply they investigate. And in family consults, this bias is wrapped in gentle-sounding words. Comfort is the priority at this stage. Let's choose age-appropriate care. We don't want to overdo things. Sounds kind, but underneath it often means, let's not offer full treatment. Let's reduce options. Let's lower expectations. So how do you fight back and get the care you deserve no matter your age? Ask, if I were 45, what would you recommend? Right arrow this forces the doctor to separate clinical advice from age bias. Bring research showing outcomes for patients your age. Right arrow many older adults respond well to modern treatments, prove it, and ask for equal care. Get a second opinion from a geriatric specialist. Right arrow they understand aging bodies and may offer better solutions than generalists. Use legal advocacy if needed. Right arrow age-based medical discrimination is unethical and sometimes illegal. Document every instance of bias. Right arrow save doctor comments, records, emails, any proof that age was a factor in limiting care. Join elder rights groups and support networks. Right arrow they can help you appeal, get alternative options, or escalate your case to the right agencies. You have every right to a full life no matter your age. If your body still fights and your heart still hopes, then you deserve treatment like anyone else. Don't let anyone tell you otherwise. This is not the end, it's the beginning of a more empowered chapter. By now, you've uncovered 5 uncomfortable truths about ageism in healthcare, realities that the medical world rarely wants older adults to see. But here's what changes everything. Knowledge is power. And now that you have that knowledge, you no longer have to be passive. You can lead every medical visit with confidence, clarity, and control. Think of Walter, who refused to accept comfort care and fought for dialysis, gaining 7 more good years. Think of Beverly, who overcame the damage caused by overmedication and got her health back. They are not the exception. They are proof of what's possible when older adults stop settling for less. Every time you challenge a biased assumption, every time you ask, "What if I were 45?" Every time you refuse to be brushed off, you are not just protecting yourself. You're shifting the entire system for millions of older adults who come after you. The healthcare industry is used to silence, but you won't be silent anymore. You are aware now, you are informed, and you are equipped with real strategies to fight for what's rightfully yours: health, dignity, and meaningful, fulfilling years still ahead. Don't let your age be the reason you're denied care. From today forward, claim your right to be treated based on your actual health, not based on how many birthdays you've had. If you've ever felt dismissed, rushed, or talked down to at the doctor's office, hit like to help more people see this message. Share this video with the older adults in your life, people who deserve to be heard, respected, and fully treated. Leave a comment. Have you ever experienced unfair treatment in healthcare? And what will you do differently at your next appointment? Subscribe and turn on the notification bell right now, because every older adult deserves life-saving care with respect and without judgment. Together, we are changing how the system sees us. Keep speaking up. Keep demanding better, because the dignity you deserve is the dignity we're fighting for.